Hi, I'm Dr. Richard Jermyn, Dean of Rowan-Virtua School of Osteopathic Medicine. Welcome to Dialogue with the Dean, the vodcast series dedicated to highlighting thought leaders who are advocating the mission of our medical school. Our mission is to foster innovation, elevate excellence in education, and enhance transformative healthcare practices. Today, we are thrilled to have Dr. Alison Mancuso, Dr. Kristen Bertsch, and Mary Duggan to talk about Rowan-Virtua School of Osteopathic Medicine Health Career Opportunities Program, also known as the HCOP Grant, and the Area Heath Education Center's AHEC Grant. Dr. Mancuso is currently the PI for the HCOP Grant, which is the 6th year of funding. She's a full professor of family medicine and serves as the department chair of family medicine. Dr. Mancuso completed both her medical school and family medicine residency training here at Rowan. She's interested in health promotion and recruiting students and residents into primary care to serve the needs of our most vulnerable populations. Dr. Bertsch is currently the PI and Program Director for the AHEC Grant. Over 40 years, the AHEC Grant has sought to improve healthcare delivery to rural and under-resourced areas by increasing the quality, diversity, and distribution of healthcare professionals in historically excluded communities. Dr. Bertsch is the course director of the Community Service Learning and Leadership Curriculum and provides psychological services at the Mount Laurel Rowan Medicine Practice. Dr. Bertsch has demonstrated history in research, training, and education with both students and professionals in the area of health equity practices in psychology and medicine. Mary Duggan is currently the co-director of the HCOP Grant and has worked with the HCOP since its inception. As a series of pathway programs, HCOP provides mentorship and support to students from under-resourced backgrounds in the pursuit of healthcare careers. Ms. Duggan has prioritized holistic well-being as the foundation of these students to thrive in highly competitive environments. She's passionate about cultivating communities of care change makers as they advocate with and for vulnerable populations. Welcome to you all.
Thank you, Dr.
Thank
Jermyn.
you.
First of all, I just want to thank you all for the service that you're doing to both our student population, our future student population, and our underserved communities. And you're really fostering a change. So my first question to you all, and it's to anyone that wants to respond to me, is tell me a little bit more about the grant and some of your grant programs and opportunities.
Mary, why don't you take it away for HCOP?
Sure. So the Health Careers Opportunity Program is a federal grant that our school has had since 2018. And this program, this grant actually allows us to run 6 different pathway programs for our school, and we work with about 100 students every year. About 60 of those are high school students from the surrounding communities, students who are aspiring to be health professionals one day. We also work with undergrads from Rowan University, postgrads here in our TBES program, and we work with medical students here at Rowan-Virtua School of Osteopathic Medicine. And so in these 6 different programs, every program is very, very different in what the outcomes are for those students, but in general, we are exposing students to different health careers. We're connecting them with mentors. Many of the HCOP students are from low-income backgrounds themselves or are first-generation college students. And so these are students who need some extra support to navigate higher education meaningfully and successfully. And so we're very excited to have our team on our campus who are able to provide that holistic support for our students, making sure that they have a safe place where they can show up as their whole selves and receive referrals to services and supports that are enabling them to thrive in health professions.
Dr. Mancuso.
Yes, so Mary is our co-director of the HCOP program, which I am the PI on, and she described all of our programs so well that I don't need to re-describe them. But what I can say is that, you know, when you look at the individual students that we help, it really tells us why we do the work that we do. And, you know, I've talked to many students in different levels of the programming, you know, who all say, you know what, I didn't know that I could do this, but because of HCOP, I learned a lot about myself, and I learned a lot about healthcare careers, and I've decided that I am going to stick with this. Or, you know, we've had students that were in our high school and undergrad programs start as medical students. And, you know, to see them on that path is just so rewarding, because these students can do this. It's just they've never had anybody in their life that has done this, or, you know, they don't think that they have the resources to do it. And that's what our program aims to do, is to get people to have the resources to follow through on healthcare careers, which then in theory leads to more healthcare for everyone, especially in the most vulnerable communities.
You know, I'm going to circle back a little bit. We said kind of earlier that this very much fits into the mission of the medical school. And I'm going to ask you to really elaborate on that.
Yeah. So I'm the PI of the AHEC grant, and it was actually started in 1971 by Congress because they recognized the need for a representative healthcare force in medically underserved areas. And so it's been around for a really long time, and actually there's an AHEC almost in every state. So the primary goal of the program, or goals of the program, is to, one, increase diversity of the healthcare workforce and representation, to expand the distribution of that healthcare workforce, and then really train students to be able to provide culturally responsive, competent care, specifically in medically underserved areas and rural areas. And so we've had the grant for over 40 years. However, our AHEC Scholars Program is a part of the grant, and that's fairly new. That came about in 2017. And so the AHEC Scholars Program is an interprofessional program where we recruit from our DO students and from neighboring institutions that have health profession programs. So we have nursing students in our program, dietitians in our program, and every year we seek to expand and partner with different health profession programs to really build that interprofessional community of students. And so the students have a certain amount of didactic and experiential hours that they have to fulfill every year, and then it will culminate in the second year where they'll carry out a legislative advocacy project. And so that's one of the main programs in our AHEC grant, and also our AHEC centers are very instrumental in our CSLL clerkship. So they provide sites and clinical opportunities for our medical students directly to get that experience. So they're very valuable to our school.
So I say this all the time. We're a very unique medical school. We are rural, urban, and suburban.
That's right.
And the one thing I've learned in the work that I do is how many vulnerable populations exist in each one of those cohorts, which most people don't think of. Like, oh, rural I get, or maybe urban I get. I don't believe necessarily that even suburban have underserved communities. And do we? So I'm going to ask you guys, do we see very much in the way of suburban underserved communities?
Of course. And I think what we have to be challenged to think about, especially working with future healthcare providers, is thinking about what barriers do people have to accessing care. And some of those are logistical, right? There are some people who have physical or mental limitations that impact their ability to go to a regular provider visit. But then also there are many other reasons why someone might have trouble accessing care, whether that's insurance issues, right? Immigration concerns, right? Or just even thinking about any other kind of, we talk in our programs about medically excluded populations historically, right? So people who might have had a history of not feeling safe with a healthcare provider and therefore have a fear of seeking treatment again in the future. And all of our students talk so much about how important preventive medicine is, but how very often people who are really struggling are fearful of preventive medicine and only access care in a reactive sense when some kind of emergency is happening. And so I know in both of our grants, we're facilitating conversations with these future physicians and future health professionals about how do you cultivate trust with different members of the community who look like you and who don't look like you? And what do you do to make sure that people feel safe coming to you? We always talk about how physicians in particular hold so much power, because it is in those moments that we as patients are most vulnerable, are when we are in that office face to face with our physicians. And so it's really a school's responsibility, like ours, to train students to hold that safety with responsibility. And so we really do a lot of work in both of our grants to reflect actively on who each one of us are and how we carry ourselves and how we interact with people different than us as well.
So I love that. We just had Acceptance Students Day, and I talk about we're going to put you boots on the ground in communities. And that's great to say, right? But how do we upskill our students to go into communities? Can you guys talk a little bit about that?
Well, in terms of, I think, going into communities, a lot has to happen first or in conjunction with that. And I think both of our grants really speak to this. So it is important to treat your patients, the person in front of you and who's in the exam room. But what's really also important is to think about the social determinants of health, right? And that goes along with the osteopathic philosophy of really looking at the whole person. And students also need to understand the historical context that we're in, understand the structures and the systems that oppress the communities we're working with. Because as you said, we have urban, suburban, and rural areas right in our backyard, which is kind of, it's amazing. If you think about it, we can drive a half hour and be in a rural community. And so it's really important for physicians and future healthcare professionals to know that history and to understand that systemic structure that's in place, because physicians are really in the best space to advocate for legislative change. And so we prepare them with the knowledge, but then we also prepare them with the self-awareness, because I think sometimes people, can feel like, oh, I just want to go into this community and help. And, it's really about building partnership and relationship with communities to build that trust, as Mary was saying, because without that trust, people aren't going to go to the doctor. So I think we really give the students in our programs this kind of really well-rounded idea and knowledge base. And I think that really, when they get into the communities via our AHEC centers or, the programs in HCOP, they're ready. They have an awareness. It's not, it's kind of, they take all of their intellectual understanding and now they're on the ground seeing how it actually is, which sometimes is very different than maybe what research they read. And so I think we not only give them those opportunities to be in those communities, but we train them to be in those communities.
Dr. Mancuso, I came to you a couple years ago and said, this is your grant if you want it. And you're like, it's no one else's grant, right? That's what you said. So I'm going to ask you, what is it about that opportunity to take this on that was so part of you?
Yeah, so the HCOP program is so important, and I'm a family doctor, right? So I like preventing things, right? I treat people for chronic conditions, I treat acute illness and injury and stuff, but I really like prevention. And I think one of the best things we can do for prevention, especially in our most vulnerable communities, is to bring people into the communities who represent what that community is. And so if you don't have programs like HCOP, you really don't have the opportunity to bring people from those communities, train them up and bring them back. And so when I, kind of learned more about HCOP, I said, this is a perfect preventative medicine action, right? We're gonna take students and show them what they can do and tell them that they can do it. And, they probably have people in their lives saying, yeah, you probably can do this, but they haven't seen it. So, we bring them in, we provide them with support, educational support, learning about different health careers, but also personal support, like how am I going to manage? I'm supposed to be, we have high school students in our programs that have a lot of responsibilities in their families that, they have to try and balance. Like, yes, Mary, I want to come to, your program, a couple of Saturdays a month, but I got to figure out who's going to take care of my little brother while my mom's at work. And so we help them work through that. And if we can get to a point where these students feel empowered to bring themselves to the next level in health careers, then they will go back to their communities and serve. and then everybody wins. So it was definitely a program that I looked at. I said, it's a mission-based program. It aligns with the mission of the school. It aligns with the mission of family medicine, which is, what I do. And so I said, there's nobody better, than the Department of Family Medicine to take on this project.
Well, I want to thank you for doing that.
Of course.
Because it's huge for us and it's huge for our future. And as what we've been saying over and over again, it's the mission, right? So I'm going to ask you one last question for all three of you. What advice would you give to your future student coming into this program, either programs, to be successful? So maybe I'll start with Ms. Duggan.
Sure. To me, that's always easy. Show up honestly. I think that what we see more often than not, and especially as I advise first-year medical students, the students who I see struggle the most are students who are not honest about what they're struggling with and are not proactive in seeking out resources that the school already provides. I always joke with students that regardless of what you are struggling with personally, it's someone's job at the school to help you navigate that. But they just need to be forthcoming, right? Rather than struggling in isolation. And so for HCOP students, it's that dynamic can be very new for students to show up. These are students who are very used to putting on a brave face and figuring things out on their own because they've had to. And so having a space where they can be open and vulnerable with what they're being challenged by and seeking out not just professional staff support, but mentorship from other students who have gone through similar experiences, that's the student who's going to get the most out of our programs. And so for me, it's always show up honestly as who you are.
Kristen, what advice would you give?
Well, piggybacking off of that, I think you learn a lot in our programs, and medical students, healthcare profession students, there's a lot of pressure on them to know the answer, to just know it. And I learned that just being in medical education for the past 5, almost 6 years. And so it's astounding to me. And so my advice to them is to practice with humility. You're not going to know all the answers. You shouldn't know all the answers. You're a student, right? That's why you're here. Be curious. A lot of folks come in, even if they want to work with underserved communities, having preconceived notions about what that looks like and what that work is going to be. And I encourage them to just take on a stance of curiosity. Just if you're having a reaction to something we're teaching or having a reaction in a community, take a beat and just be curious. What's going on? Why am I feeling that way? Or and be able to also talk to others, as Mary said, to be able to be open about that. I think also practicing some mindfulness, being in the here and now. It's so easy when we're in these, if they're doing didactics or they're in there doing their experiential hours, to think of the next thing, to think of their to-do list. I have to do this, I have this exam, or what have you. To try to really be in the moment, literally put both feet on the ground, take a deep breath, so you can really sink in what you're experiencing all around you. And ask questions. It's okay. We want you to ask questions. Even if you think, am I going to say this wrong? Am I going to offend someone is a big one? And we say, ask your questions so we can learn. And I learn from the students all the time. And so I always say, we're going to learn from each other, but please ask your questions. But that curiosity, that humility, that striving to be in the here and now is really important. And also taking care of yourself. If you're struggling, let us know. It's okay. Just be open and authentic about it.
It's not a checkbox.
No.
Right? It's a lot more. Mm-hmm. And Dr. Mancuso, I would imagine that it brings out some emotions for some students too, right?
Absolutely.
So I'm going to end with that. Again, we were talking about advice for your students, right? And what I'm hearing is about a lot of self-care, self-preservation. This is sort of what I'm hearing. And really the desire, and I'm thinking listening is in there somewhere too. So I'm going to ask you to maybe talk a little bit about that.
Yeah, so one of the most important things that anybody can do, specifically our student population, who this is something that's new for them, it's challenging, is to be patient with yourself. and to forgive yourself and other people, like Kristen was saying, where, if you're challenged by something that, like, I don't understand why I'm feeling that way, open yourself up, listen, and then be patient if you don't understand. Because I think that all of us, especially health profession students, we're very like type A, and like, I don't understand this right now, I'm never going to understand it, like, things are terrible. But if you take a second and say, you know what, why don't I understand this? Or what do I need to do this better? It's okay that I don't understand this right now. And that's where the patience comes in. And then when you make a mistake, which we're all going to make mistakes, medicine is a lifelong learning profession. We make mistakes and we learn from them. But you also have to forgive yourself for the mistake that you made, because we all are here and we're all doing our best. And so if when you're doing your best you make a mistake, that's okay. And you have to be patient with yourself and forgive yourself. And it's something that if we can teach them that very early on in their training, they'll come out much more well-adjusted and able to handle whatever it is that their career throws at them in the future.
I think what a great way to end, forgiveness. I love that. I think about this all the time, about when we make mistakes. Other people we have to forgive them, obviously, right? Most of the time it's not intended. It's a learning experience. But I find so much, especially people going to health professions, don't forgive themselves, right? You have to do that. That's self-preservation. That's really caring. And it's a great way to end this. I want to thank all three of you for the amazing work that you're doing. Please continue it another 40 years, right? That's what I'm looking for, at least, right? And once again, I just want to thank our audience for tuning in every month. So you get to listen to these great leaders to tell you all the great work they're doing to really keep our mission moving strong. And this is two major programs that you heard about today that really underscores what we do here at Rowan-Virtua School of Osteopathic Medicine. So thank you and see you next month. Bye.